initial, I would say, enthusiasm of maybe Kaletra and hydroxychloroquine with azithromycin, they now are enrolling people with trials, including remdesivir. And we have not yet reached, although looking at the convalescent plasma, but there's, as you know, a lot of therapies out there, including IL-6,
Yeah.
IL-1 inhibitors. So we're trying to make sure that patients are enrolled in trials so we can learn from them.
Okay. Thank you very much. It's where the is it seems that makes sense to make the patients get good health care. Okay. Um, Lo Ann, are you there? Lo Ann. Yes. Hi. Nice to meet you, Lo Ann. My English name is John. Can you share some experience in your hospital health system?
Yes, I am at a community-based academic teaching organization. We have two hospitals just outside of Boston, one in the town of Cambridge and one in the town of Everett. And we have a very large primary care practice, multiple clinics throughout the northern suburbs of the Boston area. And we are in our third week of surge. We surged before all the academic teaching hospitals did in Boston. Boston just entered their surge in the past couple of days, and we have been living it for our third week. And it's primarily because of the patient population we serve. We serve a safety net population, and we have patients coming to us from the largest communities that have been primarily affected by COVID-19. These are towns like Chelsea. You may have heard it on the news, Chelsea, Revere, and Everett. So we've been hit early and we've been hit hard. We still have capacity. We've had some major challenges. Dr. Gordon already referenced testing. So we've had access to testing, but the biggest challenge for us is the turnaround time. So we have blown through a lot of personal protective equipment early on. And that's been my biggest challenge is access to personal protective equipment. Respirators, primarily N95 respirators, and isolation gowns. And we've actually adopted UV disinfection to reuse our N95 respirators. And we've actually gone to using vaporous hydrogen peroxide to sterilize isolation gowns to put them back into use. In addition to that, we rolled out Tyvek suits to all our medical critical care in our surge packing areas so that we would decrease the burn rate on our isolation gowns. So those have been our major challenges. I think from an organizational perspective, we feel like we're in a better place because we've been doing it for a couple of weeks and people have adjusted, our teams have adjusted for providing excellent care. And like Dr. Gordon referenced, we're learning. And early on, people were intubated probably too soon because they wanted to control the airway. But we've come to learn that high flow oxygen keeps patients out of the ICU and gets them home sooner.
Yeah, yeah. In early stage in Wuhan, there are many patients there, so the hospital healthcare system couldn't be used for severe and critical one. How to deal with the mild, moderate patients in your hands? Do you have the temporary hospital, these like things?
So we have, in our ambulatory care setting, we have set up a respiratory care clinic for patients. And we are trying to keep patients with mild to moderate disease out of the hospital. And we are trying to manage them, many of them at home with supplemental oxygen. So that has decreased the pressure on our emergency departments. And I think we're keeping patients out of the hospital. In terms of treatment, like I said, it's really supportive care. We have also abandoned the use of a lot of empiric therapy. We are no longer using hydroxychloroquine. We've encountered some toxicity issues. And we're a safety net organization, so it's been really hard to enroll in clinical trials. But we do have access. We're just in the process of getting access to expanded compassionate use for remdesivir, so we're excited about that. And we have a couple other trials we're working on, but it's been a challenge as a safety net organization, even though it's my population that's been disproportionately impacted with this disease.
Yeah, yes. I still hope this way to get the healthcare system can be used for the severe critical one. It's a good idea, but
progression of the disease. So therefore, we will give the treatment just like anticoagulation therapy, and sometime we will once we found there's a progression of the disease in the CT scan and with high inflammatory level, we will give the short duration with low dosage steroid. So therefore, at our second wave, we found that so we can use anti-inflammatory treatment and we can use anticoagulatory treatment and give enough nutritional treatment, keep the albumin level at the very at the satisfactory range. We found the progression rate from mild or moderate to the severe case or critical illness status is the ratio is very low. So at our second stage, just recently, we found that we are not so many people that we need to use so invasive mechanical ventilate. So only one person, one patient from the 300 cases in all my patients recently in our stage, we found that we can stop the progress and only one case that need to use a mechanical invasive ventilator. So therefore, I think if the if we have a lot of patients, the most important for us is not to uh, uh, save the critical ill patients because we do not have so many ICU beds. So the most important, I think, is for us is to stop the progression of the disease. So this is our experience in current situation. However, I think if we have a lot of critical ill patients, I think we should provide enough ICU beds. So the overwhelming patients in our city, I think it will be a great burden for us. Actually, recently in our Shanghai city, we do not have so many ICU beds like that in New York and also like that in Boston. So I think in that stage, we will prepare for the the next peak of the disease in the forthcoming several months. So we will study to learn to prepare the beds of the ICU. We will do more to control the imported cases. I think this will what we have learned from the other countries. Thank you.
Okay, thank you, Wenhong. Is Professor Li Taisheng is there? Are you here? Is Professor Li is still in Wuhan? Is a national health expertise group. Can you give some introduction experience in Wuhan, especially in the severe case and the critical case therapy?
Okay, so I came to Wuhan in 7 February, and now working more than 2 months. And with our hospital, PUMC hospital, we building a temporary ICU unit in Wuhan County and treated severe and critical patients more than 100. And so, according our initial experience, so uh, so we up to now we don't find the uh, we don't have the enough evidence for the efficacy drug and for treat those patients. So for the serious and critical patients, we must treat them with comprehensive treatment, including nutrition support, oxygen therapy, and anti-inflammation therapy. As Wenhu mentioned, also very important is the anticoagulation therapy because most of those patients have a hypercoagulation. Our team found for patients, they have a lower platelet and persist lower level central count and high level diamond and CRP. So for the doctors, we treat those severe patients and critical patients, but most important is find which biomarker might be predictive as the patient be from the minor phase go to the severe or critical patients and to treat them early. So,
Okay.
yeah, thank you.
Okay. Thank you, Professor Lee. It's I think it's Ed, Professor
Yes,
Osterbaum. It's
yes,
very
yes,
nice to meet you in Holland. It
yes.
yeah.
Yeah.
It's you are our famous virologist. So can you give some comments on the virological aspect for the COVID-19 coronavirus? And
Let me give.
okay,
Uh, well, first of all, thank you for the invitation, which I very much appreciate, obviously. And first of all, let me try to give you a brief summary of what's going on in Europe. And I think it's important to realize that Europe is not one country. We have 28 different countries, and the policy implemented in different countries, I think we have 28 different policies. So there is not a universal approach. And I think when we look back to the early days, January, February, we went really from a stage of denial, yeah, where in general in Europe we could not believe that really a pandemic was going to come over us, and this resulted basically in measures being relatively mild, and from that situation we went gradually into a more when we were confronted with the enormous outbreaks that we had, especially in Italy, where they had to go to a complete lockdown, and in Spain, where also is still ongoing. Those are two epicenters. And I should say that there has been a lot of discussion from the beginning what to do with the measures in different countries. So, for instance, closing borders, etc., was initially thought to be completely unacceptable until gradually people in Europe started to realize that we had to do much more than that. And so, gradually, indeed, lockdowns were being implemented, but they were again different in different countries. If I take my own country, the Netherlands, yeah, there we had what we call an intelligent lockdown, which meant that in principle it was done on the basis of voluntary measures by people. They were being advised to stay at home, those kind of things, and that was initially without any policing measures, etc. And gradually that became more and more severe. And I think that indeed then gradually then we see that in different European countries, quite a number of patients were brought to hospitals. And the situation that you've heard from the US as well, but also from Asia, that basically there were, of course, we had a lot of patients hospitalized. ICU issue was a very big issue in certain countries, whether there was enough ICU facilities. For instance, in Spain, it is a major problem. Also, in the country like the Netherlands, it was actually feared that our capacity would not be enough. We have about 1,200 patients at the moment in ICU, and we have about 2,000 a capacity of 2,000, which we increased gradually. So there's a lot, and then basically there's a lot ongoing. Now we are at the situation that the curves are flattening a little bit, although I'm not sure whether people are sufficiently aware about the measures that could be relaxed. Perhaps one thing that's important to mention, and that especially when we're talking to our colleagues in Asia, that for instance in a country like the Netherlands, there is not enough mouth masks for the hospitals and for the care in general, also for the laboratories. So there is a problem there, and people in general are not advised to wear, or are actually being discouraged at the moment to wear mouth masks. Yeah. So there is a problem, but also about the measures. If you look at the different countries, closure of shops, closure of certain shop or all the shops like in France, there's a lot of diversity and there's a lot of insecurity there for what are the proper measures to be taken. And obviously, one of the major things that is lacking in many countries is sufficient possibilities to do the testing, similar to what we heard from the US as well, testing and tracking and then quarantining the people. Now that those measures are being implemented, but to some extent in certain countries more on a voluntary basis than on a more generic basis. So we see that in certain countries now that the R naught is going down. In some countries we think it's even below one at the moment. So the thing seems to be in control, and there is an enormous pressure in all the countries, yeah, at the moment to really relax the measures, but we're not sure exactly what measures to be relaxed because of the economic consequences, as you can imagine. So there's an enormous public discussion. Also, this, like in a country in the Netherlands where we have been in lockdown for 5 weeks now, there's a lot of pressure to actually open up again. So basically, I think we are coping well with the hospital situation. So it's not in the Netherlands, but in Spain it is really much more, and also in Italy much more disastrous. Initially, I said there was kind of a denial measures, especially during the skiing season here, yeah, in northern Italy, yeah, and also some soccer matches actually taking place there have been the reason that the virus was fanned from there. But a lot of fans going from one country to the other, coming back, and then coming at the time in other countries where it happened to be carnival at that time. So that was an enormous explosion after that because it was not appreciated. The early Chinese data actually that had shown that the virus was already transmitted very early on in the disease and even before. And actually, the policy in general in many countries was, if you're not sick, you cannot spread the virus. I think that was initially a mistake. Yeah, that was made by most of the countries. So the denial at the beginning that we had to take very stringent measures. So the big thing at the moment is how to get out of the lockdown. That's what the discussion is being dominated by at the moment. Getting out of the lockdown let the virus pass through the country, so that herd immunity would build up. Obviously, with a percentage of 3%, and we have the impression that in countries that were more heavily affected, that the percentage is higher. Yeah, that is, but it will not exceed 15% or so. So basically, if you would have to wait for herd immunity on the basis of the zero prevalence, I think we are facing a long time. So we really, I think, before that time,
Okay.
a vaccine should do the job properly.
Okay. Okay. Thank you very much. In the severe and critical case of COVID-19, there's some patients have suddenly goes worse very fast. So it seems that the cytokine storm or inflammatory storm happens. So how to deal with this situation? I hope you can share your experience from China and from American and Holland. Okay.
Well, I think China should go first. They have most of the
Okay.
experience.
Stephen, what's your opinion? What's your comment for the cytokine storm for COVID-19 case, severe and critical case?
So I think there's been a lot of how could I say that, the immunologist and the a lot of issue about the IL-6 and our intensivist actually jumped very early on the quote unquote cytokine storm. I just also want to state, and again, we don't have data on this, and as you remember, there's no such thing as a free lunch. IL-6 can cause bleeding, can cause severe infections down the line, and without randomized controlled trials, we can potentially do some harm. The other thing is that not all patients with COVID-19 who have increasing oxygenation experiences is due to necessarily the virus. As you have pointed out and others, other things can happen. Pulmonary embolus. You can have other forms of cardiogenic shock or things that don't necessarily require, that just require a good intensive care unit. So not everything is about the virus in these patients. And I think that's another lesson that we've learned.
Sure.
I do want to pivot, though, if I can, because in the United States, and it'll be interesting to hear, we've had vulnerable populations, and it looks like, again, disease, as was intimated, is also associated with zip code, meaning what we call social determinants of health. And as latest data comes out, there's a lot of underlying disease, but there's also a vulnerable populations. And our biggest one, which I'd be curious to hear, is our elderly that are in long-term care facilities. So we have 4,000 of these facilities in the United States. To date, it represents 20% of our total deaths are patients in these facilities. And as you know, they're kind of like cruise ships. And the rates of infection in these small contained areas is immense, and it is creating a lot of consternation. So I don't know if you have that problem in Asia or Europe, but it is certainly a emerging issue in the United States.
Yes, in terms of underlying disease, it's another important issue for the mortality. Is in China, many patients with mortality patients, there's underlying disease, especially hypertension, diabetes, cardiovascular disease. So it seems that the percentage of the hypertension prevalence in all stage, in aged people, is not higher than the regular aged people. But most diet patients have the underlying disease. So how to explain it? It seems that the prevalence of the underlying disease is not higher enough. But for all the most mortality patients is have this hypertension, diabetes. Do you have an idea for that?
So, in our data, and again, what just came out in the MMWR, just as you stated, although there are reports of quote unquote healthy people who have developed severe disease and died, we think that is the exception. So even the obesity coming out, as you mentioned, prior smoking or vaping, and again, other issues in terms of underlying disease. The other thing is, as you pointed out earlier, there are people that are not infected that have been affected because other types of medical care, for instance, ongoing chemotherapies or other types of disease management, have been affected in the United States. So I'm also curious, this has galvanized us for digital medicine, telehealth, and I'm just curious about your experience in Europe and Asia in terms of how that has taken off.
Yeah. Okay. Thank you.
Can I
How about the law Anne? How about law Anne? Do you have a comment for that or any question or discussion topics?
Yeah, so I wanted to comment on our patient population. We noticed early on that morbid obesity seemed to be a risk factor for death. And even in patients that had no other typical comorbidities that have been characterized as risk factors. So even before the publication started to come out, our early experience was there's something here, because the patients that were dying were so large they didn't even fit in our morgue. So that it struck us before we even had clear data that was an ongoing risk factor, and now I think there's been publications to support that. And we unfortunately have had patients, young patients, without any comorbidities die, and that from a perspective of trying to keep people's morale up, that's been really, really hard to do. But we've gotten better. I think we are doing a better job in a matter of 3 weeks managing these patients, being much more proactive with proning them early, and keeping them out of the critical intensive care unit. So I think there's been a real shift among our caretakers that we got this now. We feel like we are doing better.
corticosteroid therapy, because this virus affects with multiple organisms and systems. If you use corticosteroids, it would aggravate the disease.
Immune system. There's a CD4, CD8. Many immune system can be damaged by the autopsy, biopsy data. So, and from the clinical practice, you can see the lymphocytopenia. And recently, there are some findings that many aspects, including NK cells, T cells, B cells dysfunction in the COVID-19 patients. So we have to be awareness that the immune depression or immune compromise may
And we use some of the treatment in those who are susceptible to the severe disease. I recommend IVIG use in these patients, and also anticoagulation treatment. I think that would be very crucial in the patient, especially IVIG. That would remarkably decrease the mortality in patients. That's my personal opinion. Thank you. Thank you very much. I would like to also speak in Chinese. For severe
from the quantity to the quality. It's oxytocin can cause underlying disease worse. So this is why many patients died of the underlying disease, not only the COVID-19. So I think the MDT group is very important. In our hands, in our experience, in the early stage of the COVID-19, MDT group is very important because many patients not died COVID-19 directly. It's indirectly by the underlying disease. So this is one experience we have. Another thing is the predictor. The predictor we pick up some predictor for disease progression. Early treatment for with the predictor, including the CRP, interleukin 6, and serum ferritin, troponin, and lactase, and D-dimer. We can see the elevation of this predictor with the disease progression and the death. So I think this is very important. And the last one, I think, for the severe critical case treatment is the ICU care. So be sure that the severe and the critical case can be admitted to the ICU. This is kind of the health system challenge, but we have to do that well. Otherwise, the mortality rate will be increased. So, okay, I think the time is up. So thank you very much. Stephen and Louis Ann and Wen Hong and Taisheng, thank you for your input. I think we can discuss later to find time. Okay? Thank you. Thank you very much. Okay, we'll go to the next panel discussion. Professor Yao Long Chen will chair this session. Yao Long Chen, please.
Thank you, Professor Wang.
Okay, thank you.
Okay, thank you.
Bye bye.
我想问一下，我们胡尚莲教授和薛兰教授都已经到位啊，在有摄像头。哎，好，薛教授，我已经看到你了。哎，胡教授，好，我已经看到你们了。好。
Good evening to all of the students, colleagues who are listening to our lecture. Welcome to our second seminar. The topic for this seminar is global solutions to public health priorities. I am Dr. Chen Yaolong from Lanzhou University. I will be the moderator for this current session. We have 3 guests for this session, including Dr. Hu Shanlian from Fudan University, Dr. Xue Lan from Tsinghua University, and Dr. Janice from Columbia University, who was also notably a ballet dancer, which shows us the importance of multidisciplinary training in career success. You all have the introductions to these guests in your, so I will not go into depth about their introductions.
You have been a ballet dancer before you started your career in healthcare management.
That's correct.
我们今天的圆桌论坛呢是有2个部分。首先我会请3位嘉宾各自谈谈在当前和未来的公共卫生领域什么是最重要或最需要优先解决的问题。然后我会请
current public health work and what are the problems that we need to solve first. Next, I will ask our experts to pose some of their potential solutions. Everyone will have 10 minutes, 5 minutes to talk about the challenges and 5 minutes to talk about the solution. I will keep time because we are going a bit over time. If we have time left over, we will choose questions from the audience and ask our experts to answer them. Because we have simultaneous translation, so we would like our Chinese experts to speak in Chinese. First, let's go into the first section. Einstein once said that finding a problem is more important than solving the problem. He also said that if I had 1 hour to save the world, I will use 59 minutes to clarify the question and use 1 minute to solve it. I think you all know the importance of finding the key issue. So first, we're not talking about how to save the world. We're talking about how to solve major public health problems. We know that in this new era, there are new challenges for public health, especially in the COVID-19 epidemic. This has led us to think about the priorities that we need to solve in global public health. I will ask our 3 guests to tell us what they think are the most important public health issues that China and the entire world is facing. So I would like to invite you to tell us what you think is important and why you think it is important. Please welcome Dr. Hu to talk first. Hello, Dr. Chen and all of our guests. I will give some initial thoughts, which will be followed by Dr. Xue and Dr. Janice. I prepared answers to 3 brief questions. The first is how to better manage our public health and improve public health capacity. In the after transmission of COVID-19 in Wuhan, this raised awareness in multiple sectors. First, we must talk about governing the country. In public health, there is also governance. This governance is something that was put forth by the WHO. The WHO says that health systems has 6 blocks, one of which, an important block, is governance, which is how to lead and govern our public health system, how to design strategies, and how to implement measures, how to put forth laws to regulate. Currently, during COVID-19 in our country, regardless of if it on the national level or in Wuhan City, compared with other countries, our mortality and morbidity are not the highest, especially our morbidity. Recent mortality numbers have increased to around 5%. In terms of governments, in the early stages, it seems that there have been delays in reportings. There are issues with the direct reporting system. So when we listed the disease as a type B disease that should be managed as a type A disease, this was an important step that I will go into further depth. The second consideration is how to improve international collaboration in public health. Our national leaders are realizing that this is important now because emerging infectious diseases do not discriminate between countries. No infectious disease will only affect one country. So we need more collaboration and we need sharing of data and sharing of experience in fighting this disease. Recently, in testing and there have been great advances in testing across the world, and our country is also researching vaccines. So collaboration and openness in research in these areas is incredibly important. Also, we need to improve research on how to increase public health preparedness. In China, remdesivir trials are underway. and other chloroquine trials are also underway. But at the end, the most effective measure is the vaccine. The last issue is we learned from this outbreak that increasing funding and resource allocation is incredibly important. I saw a story from abroad who said an old man refused ventilation because he asked who was going to pay his bill because he could not afford ventilation. In Shanghai, we had recent news of two elderly people, one 62, one 64 years old. They both used ECMO machines that cost up to 130,000 US dollars. So we see how payment is incredibly important in treatment of this disease. It cannot be left up to the individual. So treatment of critically ill patients to decrease mortality and to improve patient lives, this is incredibly important. These are the three issues that I wish to raise. Thank you, Dr. Hu. I would like to summarize. First is to improve governance. Second is to improve collaboration. And third is to find funding and more equitably allocate funding. Next, please welcome
好
Dr.
的，
Xie.
非常感谢邀请我今天
Thank
这
you
个
for inviting
参加
me
这个研
to
讨会。
attend this
那
seminar.
我想这样，这个我这儿有一张 PPT，
I have
我
one
想把这个
PowerPoint
PPT 跟大家来分
slide
享，
that
然
I
后
want
这样
to
的话，
share
我想
with you
会说得更明白。也另外的话，
to
我这样
further
中英文，
clarify my
像我
thoughts.
们这个Katrina 这个，我想可能会也更容易这个
It
了
will
解。
also be
我来
easier
分享
for
一下屏幕看看啊，
Katerina to see. I will share my screen now.
可以。不知道大家能不能看到？
Can you see my slide? Yes, I can see your slide.
啊，是吧？我这个其实就是我想我就不把它放成这个什么呢？因为我放成那个正式的那个整篇的话，可能有问题。就是我的问题啊，就是应对公共卫生这个危机时主要面临什么样的挑战？
In managing crisis.
那我想这个的话呢，其实又可以分成几个方面的问题。然后我想也在简要的评论一下我们这次做的怎么样。首先第一个问题呢，就是就风险认知的问题。因为这次这个所谓叫新冠病毒的话呢，它也是一个我们以前没有碰到过的病毒，所以实际上在它这个初期的时候的话呢，我们对它其实也有个认识的过程。所以的话呢，怎么样能够比较快的这个抓住这些前期的信息，然后的话呢，对它进行比较准确的认知。我觉得这个的话呢，是我们面对这类问题的时候呢，这个我想的首先最大的一个挑战。第二个挑战的话呢，是一旦我们掌握到一些它可能带来的风险的之后，我们怎么样做出决策？那么这个决策呢，就是怎么样去权衡利弊啊？就好比说像武汉封城这样的这种决策，那么这个的话呢，可能会带来很大的这种成本啊，不管是从经济、社会各方面的成本，所以在这样的情况下，而且呢，你还不知道是吧？这种就是这个病毒它可能带来的这种危险的时候，所以这种利弊权衡其实是具有非常大的挑战的。第三一个的话呢，就是说，在我们应对这类事件的时候，尤其是到突发事件已经发生了以后那么就像实际上在武汉这个地方，就相当于是1月2号以后，我怎么样就是说，把我们的应对行为能够在这个能够提前就 move ahead of the curve， 这个呢是非常关键的。那像检测的问题，像当时这个武汉应对这个在这个20号之后有一段时间那么检测各方面的一些决策的话，好像似乎是总是没有跟上这个疫情的发展，所以这个的话呢，就是这个呢也是一个很大挑战。下面一个问题呢，就怎么样去调动资源满足峰值需求。因为在所有这些突发事件的这个发展过程中的话，它都会有一个特定的 所谓叫 peak demand 或者是 surge
In
demand。
all of these crises, there
那
will
么
be
怎么
a
样去
peak
调动
demand
各种
or
资源来
surge
满足
demand.
这种需求？
How do we
这个的话呢，
mobilize
现在是
resources to
非常大的
meet
挑
this
战。
demand? It is a very
最
big
后的话呢，
challenge.
就是像我
Lastly,
们这样一个就是这种全球性的这样的一个
a global
大的这种疫情的话呢，那
in
么
a
怎么样去
global
协调
epidemic,
各地的政
how
策？
do we
这个的话其
synchronize
实也是非
policies
常
in
关键的，因
different
为
regions?
不同地方情况不
This
同
is。also a
但另外一
critical
点的话呢，
issue
如果不是
because
大家
there
共
are
同来
different
协调行动的
specific
话呢，某
issues
一个
in
地方
different
解决了问题，
countries.
其实这个对总体来讲其实意义不大。所以
If only
这些的
one
话
member
呢，
solves
就是
the
我们应
issue,
对
it's not
公共卫
good
生危
enough
机的
for
话
the
呢
whole
所
picture.
需要解决的一些问题。
So these are the issues
那
we
么
need to solve
我
in
想的
public
话呢，
health
我不
crisis.
知道有没有时间，我想把
I don't know if
下
I
一页的话
have
呢，我
any
就来
time yet.
简单的我用中文来说，就是我们
The next
如果
page,
对我们这次这
I
个
want
新
to
冠疫情，
simply
那么中国目前这个对回答这些问题，我想
talk a bit
有
about
显要
how
的做一点
China
的
has
分析。
responded to these questions.
第一个的话呢，就是在我们讲这个怎么样去
First,
在风险
how
认
to
知上，
make sense
我
of
觉
the
得这一点的
risks.
话呢，我们虽然在这科学研究方面
In
应该说是非
scientific
常快的，
research, we
及时把它这个
rapidly
基因测序完成，
sequence
但是
the
另外一点对
virus.
它的这种
But
特点的判断，可以说
in
的话呢，
terms
我
of
们
learning about its
还是这
characteristics,
个有一些遗憾。第二一
unfortunately,
个就是
this
在
was
这种
not fast
面
enough.
对不确定性的情况下，
Secondly,
这
when
个
faced
做
with
出决策。
uncertainties,
那我
in
觉得这
making
一点的话
decisions
呢，
in the face
中
of
国政府、
uncertainties,
中央
the
政府
Chinese
可
government,
以说是
central
非常
government
果断的做出了
acted
及
very
时果断的
decisively.
做出了
They
决策
quickly
啊。那
made
这包括武汉
decisive
封城，包括
decisions.
全国一下的这
For
个启
example,
动
the
启动这样的
lockdown
政
of
策。
Wuhan
这个的话呢，我觉得是
and
应该是我
mobilization
觉得这个
across
是
the
非常
entire
了不起的，
country.
因为当时
This
在
is an
全国很多
incredible
地方
feat
其实病例是
because
非常有限
in
的，
many
但在这种
places
情况
of the
下，
country back then, there were
中央
few
政府
cases
采取的
outside
决
of
策，
Wuhan.
而且在
But the
大年
central
初一
government
马上中央最高决策机构
acted
开会
very
成立
stringently.
领导小组，
In the
我觉得
first
这一
day
点
of the
的话呢，
Chinese New
可以
Year,
说是
they set out a
为中
leadership
国应对
team.
这场
This
重大的事件的话呢，可以说是赢得了先机。
This
另
helped
外一
us
点是在 move ahead of the curve 的话呢，
this
那
helped us
这一
move
点的话
ahead
呢，
of
那
fighting
我们有
against
些方面
this
是
virus.
做的很对的，就是说
In
包括
terms of
这个封
moving
城，
ahead
包
of the
括这
curve,
个
we did
全国
some
启动。
right
但另
decisions,
外一方面呢，也
including
确实在
the
武汉
lockdown
当地
of the，city.
那么可以看到呢，
But
它
we
有
also see that
很
in
多的
Wuhan
这
city,
个具体的措施的话，也有一点滞后，所以这
they
个也
have
还是比
some
较可惜
policies
的。
that were lagging behind.
那么下面一个的话呢，就是怎么样去这个就是各
Next
地方的
is
政
how
策去
to
怎么协调。
synchronize
应该来说
policies
的话呢，
between
从我
different
个人
regions.
感觉，这一次的话呢，还是
Personally,
应
I
该说
feel
有
that
非常大的一些进步，跟中国
we
以
had
前的
a lot
这
of
个相应
advancements
来比。
compared to
那么
previous
很多地
events.
方政府根据它各
Local
地的情
governments,
况，那
according
么
to
进
their
行不管是
local
在这个
situation,
疫情防控的措施，
they
包括在它
put
恢
out
复生
measures
产
in
的时间
prevention
等等，
and
那么都根据
currently
各自
in
情况呢来做
resuming
出一系
work,
一系列的
they
这种努力。
they
最后的话
put
呢，
forth
就
a
怎
lot
么
of
样能够
efforts
去
in
这
these
个动
matters.
员这种能力。
The
那么
last
我觉得话呢，
question is how to
从这
mobilize
点来看的话呢，
capacity and
在我们
resources.
武汉应对的这个起初的这个阶段的话
In
呢
the，beginning
还是
stages
有一
of
点
Wuhan's
这个应该
response,
说还是
we see that
没有
there
跟
has
上
been a
形
little
势，
bit of
但最后呢，在全国动员的情况
lagging
下呢，应
behind,
该说
but once
我
the
们还是把这
entire
种
country
需
has
求
been
能够满
mobilized,
足。
we
所
were
以这一
able
点的话呢，我
to
觉得对
meet
任何一
the
个国
demand.
家，
I think this
那么
is
即使
for
中国这样
any
大国，
country,
就是满
for
足这种
large
峰值需
countries
求
such as
那
China.
么都是一个巨大的挑
Meeting
战。
peak
所以
demand
这也
is
恰
a
好说明
huge
我们
challenge.
全世界各个国家在
This
应
also
对这样
shows
的大
that
的这种危机
different
情况
countries
下，
across the world,
一定要这个
in
共
facing
同的
such crises,
合
we
作
need
来
to
共同
work
应对。
together and
那好，
face
我就
the
讲到这儿，谢谢。
problem together. That is all. Thank you. Thank you, Dr. Xu. Dr. Janice, Dr. Hu and Dr. Xu just gave us a few insights insights about the present and future of for China, challenges for China in the face of COVID-19, the priority issues that need to be resolved. Can you share what you think the priorities are in the global stage? And if there is time, could you please discuss what issues, which challenges in China that are similar with other countries and which challenges are different?
Yeah, thank you so much first for the invitation. I'm really happy to join this panel. Can you all hear me all right? Can you hear me okay?
Okay. Yes.
Yeah, great. Thank you so much. So, yeah, as you maybe know, I'm German-born, and I split my time between France and the U.S. So I'm quite involved with many of the political decision makers in many countries. Right now in France, in lockdown still for almost another month. Well, we see the effect. That's the positive news. Maybe just to give you the numbers for France and Germany, which are quite substantial, almost similar now. Germany, more than 142,000 cases confirmed. In France, 148,000 almost. And they were kind of, in the beginning, France was quicker accelerating and Germany was slower. And then France went into lockdown. Germany was kind of going a little bit up in the curve. And then so they kind of, went into lockdown pretty much one after the other, and now are getting to a similar stage of cases confirmed, not in terms of deaths. And that's a big question mark because Germany has managed to keep death quite low. And there are, of course, quite a lot of theories about it. It's always interesting from my perspective and as a professor in the health sciences to see how media is interpreting and filtering the numbers and the reasons and the variables that are in the end, the basis for political decision making. If you look at all the rumors, why Germany is kind of maybe successful in terms of having this low death rate, it's interesting. I mean, they say testing, they say, and that's actually one big issue. If you look at ICU beds, Germany has by far the largest amount of ICU beds per 100,000 population. So that is, I think, and that was so far a major reason why they could keep it low. And also they started testing very early. They were actually not that early with the lockdown. And I've been trying to push that, working with some of the authorities. It was very hard for them to get to that point to do the actual lockdown. It's a very decentralized country. We have a lot of authority with the different states. It's different in France. It's very centralized. They can just say, now we start this lockdown, and it's kind of done. And in Germany, it was much more difficult to get to that decision point. But getting just quickly back to that low death toll that we see in Germany right now, interesting. Also in comparison to Southern Europe, the numbers in Italy and Spain and also France are quite high, not as high as Spain and Italy, but with 18,000, more than 18,000 actually today. In France, it's quite high. The good news is it's flattening, but one major reason also why the south of Europe is so different is that all the cultures, the country cultures are very different. And whereas the Northern Europeans, they have their elderly population much more separate from the actual family. That's also one aspect that is important and not so much discussed, but in Southern Europe, it's much more common to kind of get together every day or at the weekends with the whole family. And that's also one reason why a lot of, infections happened in the elderly population. And you cannot really compare, that's one big aspect, the population that was infected in Germany with that was infected in Italy. Yeah? You saw many more severe cases also because the demographics of that population is just different, and that is going back to cultural differences, which are not really in the spotlight, but are an important factor. How do people socialize? How do they come together? Because proximity is one of the major issues in the infection process. And if you have cultures that are more close, you will see obviously more quicker infections and also more elderly and severe cases. But who else is not in the spotlight? And we should talk about public health here and public health priorities. And That was actually my first thought when you asked me to elaborate on the issue. I think this is really kind of the prime time for public health now, and public health has never been in the spotlight. It is kind of the stepchild of health sciences, and now suddenly everybody is looking at public health to find a remedy, but there is none except for if we get at some point a vaccine. There was this discussion about herd immunity in many European countries. Well, if you really look at the statistics and the death toll that would have been involved with such a strategy, it's probably, or it's definitely, also an ethical question that you cannot just say, hey, let's pursue this strategy and not take care as a country of our vulnerable population. So most countries did not do it, followed a certain strategy of lockdown. And now the question is, of course, how do we live with the virus? How are we going to do that in the next couple of months, at least? So I've been working with a lot of these political leaders in many European countries. A big issue, and I think that's important also to keep in mind when you look from China to Europe, and how certain strategies, how we could learn, how the same strategies could be implemented. Well, for the European countries, and I would say there were two phases. The first is recognizing the issue, what's actually happening, the severity of this pandemic. It took them long, and then of course this cultural background of, in most European countries, you cannot just easily communicate a lockdown. It's against their understanding, against their culture. So it was a longer process until we got to the point that this was actually a message they had to give the population. So that's why they were quite late. I can tell you mid-March, March 15, they were still partying in Paris as if there was nothing going on, and 2 days later they were in lockdown. And that was, how quickly it then happened once they they realized it, and they actually realized also they had to communicate that. So it's really hard to make these prescriptive decisions in European countries. And of course, as it was mentioned earlier, it's not one Europe. Each country has kind of taken different steps. Nevertheless, the bigger countries are kind of trying to coordinate these steps. So there is now this phase 2. What's coming afterwards? Germany is going out of lockdown, and it actually was a much less strict lockdown than in France. France is really strict, but in Germany they were still allowed to do quite a few things without permission. But what are they going to do afterwards? And Germany is going out of lockdown already on May 3rd, and France on May 11th. So distancing, social distancing is of course a big issue. And then combining that with the economic considerations, who is going to open first? Now in Germany they start with the small shops instead of the bigger shops. They want to, of course, those maybe are more vulnerable. But it's always, you have to find reasons for your political decisions, and it's just not easy. In France, it will take longer. Of course, restaurants, hotels, that's not even on the radar screen when that will open again. But I'd like to get back quickly to that cultural aspect. So tracing is a big discussion in France, in Germany, and many other European countries. Again, it's a little bit against this culture that we have. So it's not so easy to do that. Wearing masks would be, or it looks like that's going to be mandatory in many public places after lockdown. But again, it's a prescription, and many European cultures just don't like that. Okay. And testing is also, of course, on the rise, and that's important too. So they are building system remedies, and they are trying to educate the population. And interestingly, Germany, for example, is staffing up
I'm sorry to interrupt you.
Agencies. I just
Hello?
got the protocol from the Chancellor.
Can you hear me?
They were discussing. Yes? Yes.
Janice, I'm sorry to interrupt you.
I hear you. Yes.
Give me the very limited time.
Can you hear me?
Yes. Give me the
Hello?
very tight time. Can you hear me?
Yes, I'm last two sentences here.
Okay. Please.
I'm wrapping up. So they are investing in public health agencies. They are really working on, the appreciation of healthcare workers in this pandemic, and in particular nurses. So they are building on these system remedies and on public health education in the public. What about the future? Maybe one last sentence. Will it be more shared? I think we see a lot of solidarity now among individuals. I'm not sure about, also the solidarity among European states. As I said, they are discussing measures, but the question is always, will they bring it to the European level to make it a joint initiative and a joint undertaking? So yeah, that's from Europe. I think most importantly to keep really the differences in the cultures and the histories of the countries into account, because that gives you a good idea why certain learnings from China are, maybe not so easy to implement, and facing different issues, but maybe also facing different opportunities. Thank you.
OK， 好，非常感谢 Janice 博士带给我们的
for sharing. When I was listening to her talk, she mentioned the fact that the public health was never in the spotlight as much as it is right now. This reminded me of something I saw earlier. One is that in some provincial level CDCs, they are recruiting a large amount of workers. We will hopefully have more workers in public health. The next one is I see that some universities are putting their postgraduate education, focusing more on health education and public health. Because of time limits, we have an additional 10 minutes from our modulators. We will go on to 8:50. So please let us go on to the next topic. Each of you mentioned 1, 2, 3 top priorities facing public health in the world today. I would like to invite each of you to choose one issue that you think is the most important, or an issue that is most urgent that we see from the current epidemic. What are our potential solutions for this problem? Let's please welcome Dr. Hu to share first. Just now, I want to talk about the first question, that is how to improve public health governance. In the public health field, this is something that we've been talking about. That is how to set up a regulation for public health crisis management. In our infectious disease law, we have specific regulations on how to respond to different diseases, but currently these laws and regulations need to be improved. For example, our infectious disease law, we need to modify it. Recently, we have a wildlife protection law that has been recently put out. We see people saying on the internet who are saying that we need regulations on how to, conduct emergency response and management. Another higher issue that we need to think about is biosafety. Although we currently have a basic healthcare education law, this is not enough for our public health preparedness and governance issue. Second, in such a major crisis, prevention is not enough. We need prevention and education, and we need to guard against rumors when we are sharing information. So this is a comprehensive issue. We see medical institutions who are conducting sterilization. After the current epidemic, we have a triage mechanism for severe cases. So all of these experiences are experiences that we have accumulated. And in resource allocation, in public health, it's not only about prevention and treatment. In this case, was a good case of combining prevention and treatment in management. But an issue we need to be aware of is the supply chain. We need to set up a system for backup supplies for large emergency events. So this is a good chance for us to think comprehensively of how to set up a public health management governance system. Dr. Chen also mentioned how to train more public health workers and improve their capacity. The current workers who have undergone this battle, they have increased their capabilities. Even for the layman, even for our lay population, they have increased awareness. So our public health schools, we have over 100 public health schools across the country. In the future, in training our postgraduate students and training people who are currently already working, this will increase our capability to work field epidemiology. So third, to improve our workforce is an important issue. The fourth issue is how to increase our communities, the capacity of our local community healthcare workers and of village healthcare workers. Currently, it's mostly specialists who are attending treatments in infectious disease specialties or in ICUs. But more importantly, it is how to prevent across the board. Now we need to prevent import of cases and to prevent dissemination of cases within the country. So we need to increase capacity for epidemiologic work to assess risks and to do testing, to do early testing and early reporting and early referrals. So this is why we need to enhance our grassroots efforts. The next one is we need to set up an early warning system, especially a response mechanism to early warnings. In every province in our country, we have assessed the risks of different counties and different provinces. This will help in our efforts. This is important in our efforts to resume work and to continue prevention. It is even more important to set up an early warning system. So, for example, in January of this year, how we could have done better in putting the warning out early. The sixth measure we can use is in terms of data, meant to better predict the disease. Now, based on its basic transmission rates, in China and abroad, people are doing ROI analyses. Our prediction of the epidemic, our analysis of the source of the virus, and sequencing of the virus. All of these are important basic foundational work. So this is the sixth issue that we need to solve. The seventh issue is, in our actual experience, we need to set up a complete system for prevention and research and clinical treatment. These three sectors should work coherently together. We need to set up this kind of mechanism. We currently don't have therapeutics, we don't have vaccines. So in this background, scientific research is incredibly important. Back then, when we had a lot of patients, now we don't have so many patients, so it's more difficult to conduct research. And lastly, I think we need to learn about crisis management lessons from different countries across the world. It's hard to say which country has the best measures because different countries have different healthcare systems. The measures they put out are based on their own their own situation. So we can't recommend other countries to use China's experience, but we can learn from others' experiences. For example, we required wearing masks and social distancing and hand hygiene. We also forbade crowd gatherings, but in some different countries put forth different recommendations in these matters. Some countries focused on hand hygiene, some focused on social distancing. This is because there are differences between different countries. So I think it is important to improve communication of experiences in facing public health crises between different countries. This will improve our public health governance capabilities. Thank you. Thank you, Dr. Hu. He mentioned 8 different solutions. Thank you for sharing with us. Next, please welcome Dr. Xue. Dr. Hu said a lot. I don't really have that much to add. In terms of what he already mentioned, I want to talk on 2 points. The first one is, in the early stages, in risk management, how to better improve risk management. Risk management means to mitigate the risk before it has developed. This is incredibly important. I think this should be done in 3 steps. The first is to recognize the risk, to capture the early warning signs. The second is to understand the risk, to analyze the data that we have acquired. Third step is to predict risk after we have some early data. These 3 steps, if we do them well, then we have a chance of mitigating the risk before it begins. In the first step, we have a direct reporting system, which is important. But apart from this formal method of reporting, can we use informal methods? For example, on social media. We need to pay attention to the early warning signs that appear on social media. And second is in analyzing the risk. I feel that our expert team went to Hubei in 3 ways, and we shared our information through a media report. It shows that our analyzation of the data is not as good as it can be. We need a system to better analyze and draw conclusions from the data. We need a responsible expert group that will go in and find information. People are required by law to disclose information. They need to be able to give their decisions towards the decision makers with the data that they have. Decision makers should take in opinions from the experts based on other considerations, and then to decide whether to alarm the public and how to communicate with the public. If we are able to do this, we will be able to stop such outbreaks before it becomes a big issue. Just now, Katerina also mentioned different governance systems between countries with different cultures. I agree wholeheartedly. In China, different areas in China, when we use the same policy, it has different effects. In terms of prevention policies, they should be divided into 2 types. The first type is medical or physical regulation, such as washing your hands and wearing masks. This type of, whether or not this type of regulation works, we need to analyze this thoroughly. For example, do I need to wear masks in an open space? Should I wear masks in what size of a crowd should I be wearing masks in? I think analyzing this information will be useful for any country, and also including hand hygiene, etc. This type of regulation should be, it's scientific, or it's based on science. This type of policy should be the same between China or Germany. So we need this kind of information. The second type is what I call social policies, such as locking down the cities or social isolation or self-quarantine. This type of regulation depends on your audience or the cultural or living environment of the people who are living in the local communities. So different policy tools will have different effects implemented in different places. So this type of policy, we need to take into consideration the different aspects of different places. So I think we should increase communication regarding these types of policies. Thank you, Dr. Xu. Dr. Hu gave us a comprehensive discussion. Dr. Xu gave us a deep, thorough discussion of two points, risk assessment and policies. Lastly, let us welcome Dr. Janice to choose one issue that you think is most important and share with us how you think we should solve this issue.
Yeah, thank you so much. I will be very short for the sake of time. While also the others were talking, I mean, right now we are working basically on crisis management. And I think if you ask what is important for the future is moving from that mode to actually building resilience. So being prepared and not preparing for a pandemic while you're actually living in it. So we need to be more forward-looking. We also need to stay humble. I think a lot of countries just get too comfortable and maybe too arrogant also, that there will always be unlimited growth and things will not change. And this kind of attitude was, of course, very detrimental to the beginning of the management of this pandemic. And many programs that existed for preparedness were actually stopped. So it's not that there were not these public health programs, but many of them were stopped like 10 years ago because everybody thought this would be going on like ever and we would be fine and living in good circumstances. So at last, I would say sharing knowledge, as the others mentioned as well, is important, but also keeping knowledge. What do I mean with that? If you look around in Europe, we don't have supplies, or we have not enough supplies, but we are also not able anymore to produce them. So it's, the downside of globalization, as much as it's great that we collaborate globally, but if we unlearn how to actually do it, we are in trouble once you have a crisis situation. So I think a more even, let's say, sharing of knowledge, and at the same time keeping the capacity, the capability to do something. If maybe one thing happens in one country and you could replace each other's competencies, that would be very helpful in the mid to long term if we think about future preparedness.
好的，哎呀，时间把握的非常的好，真的，今天
our time limit has reached our time limit. I'm sure we all have learned a lot from this session. We are just on time right now. I have received many interesting questions, but we are unable to discuss them further, unfortunately. But this is also good because we will be looking forward more to our next forum. I have about a short conclusion. We are a quarter in towards 2020, but this several months have been written in the history of mankind. Even though currently globalization is an important tide, there is also anti-globalization. Even though we have not found cures for non-communicable diseases, we have emerging infectious diseases. We see increasing numbers of medical knowledge, but sometimes this is overwhelmed by information on social media. This is the best of times, and this is also the worst of times. We see many patients who are currently affected with COVID-19, and we see also many issues that we need to continue to resolve. But it is the best of times because we see so many medical experts and other experts who are working against the COVID-19 disease. We need to produce and to use higher quality scientific literature which is a weapon in our fight against COVID-19. I want to thank our guests and our hosts. Thank you to all of our attendants who are still learning on the weekends. Thank you very much. Goodbye.
Thank you.
Thank you too. Thank you for sharing. We hope that such seminars will continue. This is only the first one. Thank you, everyone. Good night. We have a satellite conference. If if our attendants are interested, you may continue to join us. Let us invite Dr. Wang again.
I just don't really want to do it. It's like stupid. Like now like no one assigns good homework because it's all just so lame. Oh, do an escape room. Like what? Oh, yeah. Are we meant to think that it's interesting? Are we meant to think that making escape rooms is interesting? Why can't we do something more conventional, like maybe do a worksheet or